slide. Now I am going to explain what is the importance of PVPI by showing one severe reaction and one mild reaction. For example, this patient, he came to me in the year of 2007. He is about 43 years in 2007. He is a known asthmatic patient. He was sustaining with Foracort 400 mcg for 15 days. Then the maintenance dose is Foracort 200 mcg. Then for maintenance of the other symptoms, he is prescribed with disloratadine. So during this a decade of period, there are some drugs are added, some drugs are removed. I didn't mention anything, but the day one when he came to me, that is in 2007, and when he come to me in 2017, only the prescription drugs that are prescribed in 2007 and 2017, I'm going to focus on this presentation. So initially he used to take Foracort, which consisting of formoterol and budesonide. Formoterol is a LABA, long-acting bronchodilator. Budesonide is a steroid. Then even intermediately he changed it to even the drug like Maxiflo, which consisting of formoterol as a bronchodilator, and we have fluticasone as a anti-inflammatory drug. Both are budesonide and fluticasone, both are anti-inflammatory drugs. So he is using the steroids for years for maintenance of the asthma. Although he is using MDA, all of a sudden in year 2017, please next slide, he came with a symptoms like initially he came with a symptoms like blurred vision, floaters, fluctuation in the vision, distorted vision, dark areas, poor night. If it is not going to be treated properly, there is a high possibility of losing even vision. So how the pharmacovigilance will help in this particular case, that I am going to explain now. So generally, by taking this case presentation, I want to stress the components, elements that we are using in PVPI. Generally, any event, adverse drug reaction or event that can be expressed qualitatively or quantitatively. When we are coming to the qualitative, so these are all the various symptoms, what the patient presents in front of the prescriber or to the healthcare professionals. So how to validate this quality of these symptoms by medical devices. Next slide. So this is the symptoms of this particular patient. So the fundus of the patient is observed by using a test known as FFA test, fundus fluorescent assessment test, which cost around 2,000 rupees per episode. Here fluorescent dye is given through IV within a minute of 10. We have to capture all these things through the device. So when we did for this particular patient, the fundus shown that there is a lipid accumulation. Due to lipid accumulation, there is an increased vasopermeability. When there's, see, these things are happening just because of the drug toxicity. The drug toxicity, because it may be acute toxicity due to taking of lethal dose or higher dose. Otherwise, in other words, we can say that it may even due to chronic use of steroids. So what are the changes are that happening in the fundus? Like, so there is accumulation of the lipid. So due to accumulation of the lipid, there is a accumulation of the, so there is an increased permeability. Vasopermeability will be the accumulation of the fluids are taking place, so that there is a development of lesions in this fiber. There will be a micro infarcts. There will be a supply of blood will be diminished, reduced, and then we are having even there is a micro aneurysm is there. Micro aneurysm means there is a vesicular formulation will be taking place, so that there will be a dots will be formed that leads to hemorrhage. It is in the form of flame shape. Hemorrhage will be there. Generally, the case of this particular one is chorioretinopathy. I just mentioned here as a retinopathy. So it may be due to age related also there. How you are going to rule out this? This reaction, is it an age related problem because of a stress induced disease, or it may be due to drug induced? How that we can make it? By introducing the concept of pharmacovigilance. challenging and de-challenging concepts. Next slide. So when we are coming to this, after seeing all these symptoms by the patient, then we send this patient to the ophthalmic opinion after seeing this fundus examination, and also patient is subjected for OCT, where the physician said that because of chronic use of steroids, there is a possibility of chorioretinopathy in the patient, so that there is a distorted vision, blurred vision. Even if it is not going to be treated properly, there is a possibility of irreversible blindness. So immediately he suggested not to use steroids in any form. Generally in asthma, we have oral injectables, nebulization, and even DPI is there, MDI is there. Even this patient is depending on MDI. Only 10% of the oral drug is reaching the systemic circulation. Even in such, because of the chronic disease, there is a cumulative toxicity. So these type of activities we are really missing in the hospitals because lack of clinical pharmacy people. Next slide. So now we are going to rule out whether this is age related or drug related. So we are going to, can be done by using a device, ocular coherent tomography. Ocular coherent tomography, where you are going to measure the macular thickness. Macular thickness, it is nothing but the center part of the retina. We can call it as a macular thickness. It is about 1 square millimeter. 1 square millimeter will be there in the retina. The center part of the macular, where you will, the part is known as fovea. Fovea, you can call it where you will find rods and cones, which is responsible for color differentiation because of this drug reaction. So we are going to make it as a macular cube, and all 9 segments are going to be measured by means of ocular coherent tomography. Simply we can call it as OCT test. Next. So this is the right eye, this is the left eye. The parameters like central subfield thickness is measured, cube volume is measured, cube average thickness measured in either eye of the patient. So when coming to the next right eye, so the average cube average thickness is 269. It is almost just above the normal. Generally, the normal macular thickness is around 255, plus or minus 13 will be there. When it is coming to the OS, so it is about 343. It is very abnormal. That shows that eye. Why it is particularly there in the left eye? This is more complex because the diseases are more complex that we cannot define. Over a period of time, even the right eye will also get affected. Here we are going to measure the thickness of the macular in terms of ILM and RPE. Inner limiting membrane, the thickness between inner limiting membrane and retinal pigment epithelium that we are going to measure. The thickness between these two are known as macular thickness, that can be measured by means of a ocular tomography. Next slide. Next slide, please. Next slide. No, previous one. See, now I am going to compare. See, on steroid, what is the value we are having, particularly on the left eye. For example, on steroid, the patient is having central subfield of 622 micrometers, a mean of 343. When this patient is subjected for uniform is removed, and immediately non-steroidal anti-inflammatory drug roflumilast is introduced for the patient, and he kept in observation for 15 days as a washout period. The patient is maintained, the symptoms are maintained by replacing roflumilast, and we are prescribed ipratropium bromide, which is a rescue medication for the patient, but still he needs it, so we prescribed it for the patient. After 15 days, we observed that in the left eye, it almost come down to the 270. So that shows that when de-challenging means the removal of the drug and kept in observation, so that the symptoms are subsided. So that these type of reactions are called a positive challenge. This is known as positive challenge. Negative challenge in the sense, if the symptoms are not removed, then you can call it as a negative challenge. So these are the two components which are there in the pharmacovigilance programs. So by applying these principles, pharmacovigilance program, the patient is survived. Often 15 days, even after that, now he is happily living after 2000, but he is using the roflumilast and other asthmatic drugs. Next one.